Hi, I'm Randy Ruda, Chief Executive Officer of the National Health Council. The National Health Council's mission is to provide a united voice for the 160 million people living with chronic diseases and disabilities and their families. We promote increased access to affordable, high-value, equitable, and sustainable health care. More than 150 national health-related organizations and businesses are members of the National Health Council. You know, it's now been over 3 years since the official start of the COVID-19 pandemic. And patients, healthcare providers, and public health experts have learned a great deal. But it can still be challenging for individuals to determine their personal risk levels, and the National Health Council wants to ensure that everyone has access to reliable and up-to-date information about their health and risk levels. So we're excited to share this Trusted Messengers video series with you, featuring leaders, experts, advocates who can help address two of the most important questions facing patients today. What factors increase risk for severe outcomes with COVID-19 diagnosis? And further, how can we help reduce that risk? So today's discussion focuses on cardiometabolic disease and how it relates to ongoing risk in connection with COVID-19. And with this information, we will encourage you to talk to your trusted healthcare provider for medical advice and to make your own COVID plan. I'll start with you, Joe. So what was the experience of your community when it comes to the pandemic? Were there lessons learned as you're looking forward, particularly right now as we're focusing on those patients who, may be at risk of understanding the risk of COVID-19? Maybe it's a first-time infection, maybe it's a secondary infection. How can we really understand what's happened in the last few years, what we've learned, and what we should be thinking about going forward?
You know, it's been particularly challenging for people living with obesity. You know, we've always struggled with the stigma and bias around this condition of obesity, but then we added COVID on top of that. And, in some of the early reports around COVID where it's like, well, it's only big people who are getting affected by this, right, kind of thing, and that's all their own fault because they live in these larger bodies. And then we saw, stories about, well, maybe the vaccines won't work as well in people with obesity, and that's actually proven not to be true, right? And all of this moving forward. And so now as we've shifted, to this, post-pandemic era that we're in right now, we really have to challenge folks. I mean, many people with obesity simply avoid going to their healthcare provider, right? They avoid having that trusted conversation with a provider, and it's so important right now that people actually have that conversation because COVID still exists and it still does affect those of us who live in larger bodies, those of us that have obesity like myself, in a greater manner than it does others. And so it's important that you have a plan and that you actually have prepared in advance if you happen to get diagnosed with COVID.
We were talking earlier about the importance of a plan. And I see you both nodding. Yeah. So you really do emphasize that having a plan and being able to consider these things in advance. And I guess that plan is not just you, but it's in the context of your family, your support system. Is that right?
Yeah. For me, I always say diabetes is a family disease, but all chronic diseases are family diseases, right? And so you have to have your backup systems, and because people want to give the disease just to the person, and it just doesn't work that way. Right. So it's always good to incorporate everybody in your plan.
Sure.
My own experience with COVID-19, right? And as someone who's a leader in my community, the reality was when I suddenly realized I was sick and I tested.
Yes.
And then I tested again the next day to make sure it was accurate. And then I called everyone who had just been at the meeting with me to let them know. And then I got my family isolated and I got all those things done. And I realized, you know what? In taking care of everybody else, I didn't take care of myself, and I missed my window to get some of the treatment. And so I think that's why we emphasize a plan so much, right? Because really from personal experience, I realize a lot of us who are very much, it really embarrassed me, right? That I didn't actually have a plan on.
Because you're as educated and tuned in to all of this as anyone.
I work on this every day, and I didn't have that plan. So that's why we challenge folks really to stop, set the time, make your plan, right? Hopefully this doesn't happen to you, but if it does, here are the steps you're going to go through to make sure that you get as healthy as possible, as quickly as possible.
Have you heard the quote from Mike Tyson? Everybody has a plan till they get punched in the face.
You're the importance of this. Here?
Yes, really when it comes down to it, knowing where you are going to get tested, who you were going to contact. I mean, there were multiple steps. That window, of course, once the therapies were available, was very important. And if you didn't have a plan in place and you didn't know who to call or where to go, you were on your back foot. That's right.
Yeah. You know, for diabetes, how does that affect the severity of the illness? Are there some special considerations there?
Just higher blood sugars. Everything is out of whack when your body's just not feeling well. So you have to be very careful because some people will get nauseous. You're throwing up, that means you're not keeping food down. Medicines have to be adjusted. Insulin has to be adjusted.
Sure.
So you can end up in the hospital because your numbers are either way too high because you're sick or way too low because you're not getting enough adequate food that you might need. So it's a challenge. The mental health component to it. With any chronic disease, you need some healthy coping skills. And so if the person's not coping well, they're not going to do well. They're not going to seek out a plan. They're not going to take their meds. So that's a piece that I think we need to discuss at some point, too.
That's a really good point. You agree?
I absolutely agree. And I think, a lot of times when we think of mental health, we think about that people go seeking care and treatment for how they're feeling.
Right.
But a lot of times it happens that they're going and engaging with their care team and they're like, I can't sleep, or I feel anxious, or I have a headache, or I have a stomach ache. And so again, that kind of that engagement with your care team, where your physician can say, okay, this is the second time, let's dig in a little more and talk about what's going on.
Thank you for calling that out. I can really validate that from the perspective of the National Health Council. So I mentioned earlier, we've got almost 160 national organizations, the majority of which are patient groups representing the whole range of disabilities, chronic conditions, complex conditions, age-related conditions. And the one theme that emerged, as we just talked about in our conferences and things, is so what should we be focused on? Mental health emerged with the understanding that anyone with a chronic condition or disease, and I would also argue that within your support systems, the professionals, the paraprofessionals, the caregivers, mental health at this point in time is an issue that all of us have a shared interest in, clearly.
Yeah, one of the things that I do before I start teaching anyone about diabetes is I get to know the person. Get to know them. By the time I'm done, I know grandmom's favorite recipe, I know Uncle Joe's blood type, all that good stuff. But if I don't get to the part while they're not doing what they need to do, it gets to be very hard.
I asked Helen to say what might be unique in the diabetes community when it comes to understanding the severity of illness and the risk that COVID-19 continues to pose. For the obesity community, for people in that position, are there some unique things that
Well, I think early on,
by?
I think early on everyone thought it was solely about your body size, right? I mean, and that kept your lungs from expanding when we were talking about this primarily being a disorder that affected your lungs. But then we've actually learned, obesity is about inflammation, right? And it causes that. And so COVID expands that effect. And so I think that's why, many of us who live with obesity, every health problem we have is blamed on our body size. But I want to be very clear to folks watching this today. I mean, you truly are at risk when you have obesity and you develop COVID, and it can have devastating consequences. So I really do encourage people to seek that care, right? Don't assume that this is based in stigma and bias. And I know a lot of your other experiences may be based that way, but please do seek help, especially if you develop COVID.
I'm interested to know, for people that believe that their risk ended, I've mentioned this earlier with the public health emergency. Have you heard from some of those people? Have you heard that within your constituencies, or are they less likely to feel that they need that doctor's visit because, it's over? Is there information around that, or maybe other notions that exist that you'd want to call out?
Well, I'll call out people's belief systems and their value system, what they grew up with. Grandmom's instant cure for stuff that they carry through generation to generation. That has been a real challenge. And it goes back to the lack of trust. If you don't trust your physician, you're trusting grandma more than you trust your physician, what are you going to do? That's a challenge for you to even get them to go. So that's what I've heard lately. It's been a big one. No, I don't want to go, and they don't trust the system. It's just a mess, just a total mess.
So how do we get past that?
I try to have them be advocates for themselves. I give them points like, okay, this would help if you do this is going to help you, or why don't you want to do this? Give me more feedback as to why you don't want to do that. But education is the key. I feel like the more you educate, the better.
Well, and that's where we're feeling like it's people like yourselves and your organizations that are indeed trusted. They've done the hard work. They're in the community. People know, hey, this individual, this organization's on our side. We have to leverage that. Because what you're suggesting is a human nature kind of thing. And pushing back on grandma's home recipe,
exactly.
That's going to be tough, like you say, in any circumstance. Right. But maybe is it a and but or something? Maybe it's, talk to your doctor, have that plan in place, and have the chicken soup because it's so good for you anyway. Did you have a comment?
So I was just thinking around this whole, this change that we're in right now. You have to remember folks were isolated for a while, right? And we all wanted our freedom back, and so we've gotten it back now. So it's almost like we have to start over a little bit, right? I mean, it's not the isolation, complete isolation that we talked about earlier, but we have a better understanding now. We know where we are, and so I think all of us have to continue to deliver these messages like we're delivering now, that there still is a risk. You need to understand your risk. You have to measure your own personal risk, and then you have to make decisions based on it. And by the way, you probably shouldn't be making that decision about your own personal risk without talking to a trusted healthcare provider about it, right? And I think that's key, because a lot of people are making that decision, I think, based on what they're reading on the internet or without actually seeking trusted advice around this. And it's important, right?
Sure.
Your health is between you and your healthcare provider, right? And so go ahead and have that conversation. And by the way, if you don't feel as if your healthcare provider is your trusted source, then that sends a signal right now. You need to seek another healthcare provider, right? And actually find one that becomes your trusted source.
That's a really interesting point, because I've seen some work where people, and I've heard patients as part of panels just saying, I just wasn't getting what I needed from that practitioner, so I changed practitioners. And you saw people in the audience kind of, well, they clearly they were in a place where they could do that, because that's not always a no-brainer. Maybe you can share, and maybe it's even calling out contact for your own organizations. Where is that information? I have a suspicion, because I know your organizations well enough, that you've got resources, you've got brochures, you've got 10 tips for a great meeting with your physician and all those things. Where might patients look for that information, access it? What's out there?
For the American Diabetes Association, you go to diabetes.org. You're going to find a plethora of information on that website. I mean, anything related to medicine, food, anything you could possibly want, you can find on from this organization on that website.
From obesityaction.org, so that's the OAC's main website, same. You'll see the same thing, everything around it, obesity. And then specifically on how to talk to your doctor, especially when you live with obesity. We have a campaign called the Your Weight Matters campaign, so you can go to yourweightmatters.org, and there's actually a guidebook that actually leads you through a conversation with your healthcare provider to make sure you have the best conversation possible.
That's fantastic. Talk about practical advice.
Yeah, we have a site called familydoctor.org, and that is actually created for patients to help them engage with their family physician. And so that can be things about certain disease states, that can be about questions to ask your doctor, how to plan for a visit. We pushed a lot of resources about COVID-19, about vaccine hesitancy. And so that's always an up-to-date resource that we do to try to help our members to provide information to their patients, and they actually use that in the care setting where they can push that to them.
Before we close, what's your call to action? And that could be a call to action to our patient community that really, wants for themselves and their families and their neighbors to lead healthier lives. What would be your call to action around this topic?
Well, my call to action to patients would be, it's okay to be an advocate for yourself. It's okay. Find all the resources that you can find relating to your disease. Even if it's a family member, just find your information and know that it's okay to be an advocate for your own care.
That's great. Joe?
For those of you who live with obesity, I know it's hard to go have these kind of conversations with your healthcare provider, probably because of some of the stigma and bias you've faced in the past. But it's important that you do so, right? The risks here are real. I know your obesity gets blamed for everything, but the reality is that when it comes to COVID and obesity, the risks are very, very real. So have a conversation with your healthcare provider about your personal risks and develop that plan if you do unfortunately contract COVID.
Sure.
I would say mine's pretty similar. Visit your family physician early and often. And create that care plan just so that you have that level of comfort that the people around you, including your care team, knows what you want. You are in control of your health, and there are people that are standing ready, willing to help.
I think this conversation has the potential to help improve people's health, the choices that they're able to make, the plans they put in place, I suspect that lives can be saved here. And I think that's kind of why we get up and do what we do every day. And not having to call all your friends that you were just at a conference and tell your family they have to live in the basement or whatever it might be. Real results can come as a result of this conversation. And I just applaud each and every one of you for the work you're doing every day, for being a collaborator on this effort and with the National Health Council. Patients with a plan are going to be better off for it. And I think we've got the right mix of resources, talent, and passion to achieve that goal. So thank you, each and every one of you.